Everyone. Welcome back to Public Health Insights. Today, we are going to understand a very important topic that is health committees and the development of health services in independent India. This topic is very important not just for UGC examination but also other medical examinations as well as UPSC and state PCS. So let's understand how India's health system evolved after independence and how different health committees shaped the system as we see today. So before we study individual committees, let us understand why this topic is so important. So, health committees laid the foundation of India's public health system. That means these committees help policy makers in deciding which areas to focus, which population to focus, and what all can be done to improve the public health infrastructure. So, they basically guide for the rural health infrastructure. They also worked on medical education reforms and they also made sure that not just curative health is focused but also the preventive health is focused. The these committees, we clearly understand how India's health policy evolved from 1947 to the present day. This topic helps us connect history with the current programs that are very relevantly uh, followed, like National Health Mission. Then we have National Rural Health Mission and also Ayushman Bharat. So, talking about independence. So, India was facing a very poor health situation. The infant mortality rate was extremely high, that is, more than 150 infants died per 1,000 live births. So, that is a very disturbing data. Then mortality was also very high. Communicable diseases like malaria, tuberculosis, smallpox, cholera, all these were very widespread. Also, people were not having good quality of life. They were not having good education. They were not having good source of income. So that led to malnutrition, poor sanitation, and lack of safe drinking water that made the situation worse. The health services were mostly urban based and hospital centric, and there was no organized rural health system. Created an urgent need for health planning and reform. So, why were these health planning committees important? So after independence, like we just studied, after independence, India needed a scientific and systematic approach to health planning. The country required long-term planning based on population needs. There was also a strong need to integrate preventive and curative health services. Committees acted as advisory bodies and provided blueprints for health services. So these committees helped government make informed decisions and design national health programs accordingly. Now we'll look at the major health committees. These are mentioned year-wise, and also I've mentioned the chairperson because many a times, the same question comes: who was the chairman for this committee? So actually, it is very easy because mostly the the committee is named uh, as per the chairman's name. But then also you need to have this in mind so that it becomes more clear and relatable. So here you can see the list of major health committees formed after independence. So starting with the Bhore Committee, that was uh, that was actually formed in 1946. I would not say just 1946 because before the independence it was actually made. The committee was planned before the independence era, but the part actually took place after independence. Okay, so starting with core committee, then we have Mudaliar Committee, Chadha Committee, Mukherjee Committee, Jungalwalla, then followed by Kartar Singh and Srivastava Committee and Bajaj Committee. So each committee focused on specific gaps in the health system and contributed unique recommendations. Why? Because one problem today's problem might not be tomorrow's problem. So these health committees had been evolving and were very necessary because they took focus, they actually focused on what was the current situation, and then they provided recommendations for the current scenario. So it is very important to discuss each committee. Let's study the most important committee, that is the Bhore Committee. Why is it important? Because it was one of the first committees after independence, and also recommendations are being followed even today. So, Bhore Committee is one of the most important committees that you need to memorize. Each and every word here is very important. Okay, so the Bhore Committee is considered the most important committee in public health history. Its official name was the Health Survey and Development Committee. Now you need to memorize this very well. Which committee is also known as Health Survey and Development Committee? So we'll answer Bhore Committee. So who was the chairman? Sir Joseph Bhore. Year, 1946. Basically, it was framed pre-independent. Uh, the recommendations were actually implemented post-independence. So we'll just memorize 1946. Now, uh, what were the recommendations of the core committee? So the committee strongly emphasized the integration of preventive and curative services. Why is it important to focus on preventive services? It is very important because there are many reasons, but we need to know that when the preventive healthcare is strengthened, this reduces the burden on curative services. So that actually leads to better quality of health services. As we see today, people are very aware about everything, their health, everything. So they are focusing more on preventive side. Why? Because it actually saves you from getting severely sick. It also reduces the burden of treatment and curative part of healthcare. It also reduces out of pocket expenditure for both the government as well as the individual. So Bhore Committee is very important. You need to remember this keyword. uh, that's the reason I have highlighted all the keywords, that it gets framed in your mind. So, who gave the recommendation of integration of preventive and curative services? So, it was Bhore Committee. Then, we the Bhore Committee also gave a recommendation of three-tier health system. Now, what is three-tier health system? I'll just explain in the upcoming slides. Now, other recommendation. What was the third recommendation? So, the whole committee recommended that for every 40,000 population, we need to have at least one primary health center. Uh, Why centers were important? Because primary health centers are the grassroots centers of healthcare. So whenever people used to get sick, they would just go to district hospital and community health centers at the bigger level. So what that created, there was lots of mess because doctors, number of healthcare providers were very less, especially at that time, and the number of patients were very high. There, there were many reasons for it, like illiteracy, then poor sanitation, you know, due to lack of employment, malnutrition. So the burden on healthcare was very high. So it was much needed, the much needed thing of the hour, primary health center. Who proposed it? The Bhore Committee. For one PHC for how many people? 40,000 people. Okay. Then also suggested reforms in medical education and introduced the concept of social physicians. Now, who are these physicians? So, recommended that uh, a healthcare worker will be trained for 3 months and then they'll be working in the rural setting as social physician. Why? Because at that time number of doctors, educated doctors, were very less, and the problems were very and the healthcare problems were very high, like mortality, infant mortality, maternal mortality, and due to water and sanitation problems there were many communicable diseases. So it was the needed thing of the hour. That's why social physicians was the concept that was given by the Bhore Committee. It also focused on community oriented curriculum. Now, what does this mean? Community oriented means the grassroots oriented curriculum. Okay. First committee to recommend universal access to healthcare. That is, focused that every individual should have access to healthcare. Okay. It also emphasized that responsibility for health of people was not just the individual responsibility but also the state's responsibility. That means the government's responsibility. Okay. Inspired community development programs and PHC establishment all around 1952 to 1953. Now, this is the three-tier healthcare system that we just saw in Bhore Committee. So, what is it? You can see are three levels: primary level, secondary level, and tertiary level. Now, what do these mean? So, primary, most decentralized level, that is the lowest level. Have in the middle the secondary level, and at the top of the hierarchy we have the tertiary level. So at the primary level we have sub health center, which actually for every 3000 to 5000 population we have one sub health center, CHC. Okay. And above it, so what are the actually things that you would get, or what are the features that are specific to sub health center? So it is basically concerned with the lowest level of treatment that is available, like first aid and medicines for minor illnesses. These are found in the sub health center. It is for every 3000 to 5000 population we have one sub center. Then coming up to the upper hierarchy, we have primary health center that covers around 20,000 to 30,000 population. The sub-center and the primary health center both come under the primary level of healthcare. We have community health centers that are the CHCs that cater to around 80,000 to 1.2 lakh for population. Above it, we have sub-district hospitals. These come under the secondary level. Now, talking about tertiary level, we have district hospitals and medical colleges and hospitals. These are placed at the highest hierarchy because they provide the best, uh, treatments. They have the highest level of expertise there. The healthcare staffs are highly equipped, and it actually sees all the complicated cases. So why is it important, the three tier healthcare system? Because it reduces the burden. As we go higher, we have you just see the pyramid. Okay. So what happens, you just remember, this is a pyramid. That means the burden is actually reducing. Why? Have minor illnesses like fever, cough, cold. So you won't go to the district hospital or medical college all at once. You go to sub-center or primary health center or maybe CHC. So what is the significance? The significance is basically reducing the burden on the tertiary level. Now we have the Mudaliar Committee. So Mudaliar Committee was planned in 1962. Who was the chairman? Dr. A.L. Mudaliar. Its main focus was on strengthening existing primary health centers rather than expanding the numbers. Why? Because primary health centers were recommended Bhore Committee itself, and then they were established around 1952. So after that, the Mudaliar Committee actually emphasized quality should be improved. The primary centers should have better quality, and not just the solution to the health problems would not just be of increasing the primary health center, but basically improving the quality of the primary health center. We believe in quality over quantity. emphasized better supervision, improved referral services, and strengthened district hospitals. It also focused on district hospitals, so that was very good. And why I have focused on referral services, because earlier the referral services was not very well focused, and people were not aware that if you become sick, you need to just if you are sick, lightly sick, you need to visit the at the primary level. If you are feeling that I'm more might go to the secondary level, and then if there is something complicated, go to the tertiary level. So the referral services was smoothly emphasized. This was one of the recommendation of the Mudaliar Committee. Then, unlike the Bhore Committee, which focused on expansion, the Mudaliar Committee focused on consolidation. Now we need to remember this. Why the Bhore Committee focused on more on expansion? Because during the initial years of independence, the number of hospitals in India was very less. Okay, so the main problem at that time was having good number of hospitals. So the Bhore Committee focused on expansion. When we had already had primary health centers established in 1952, need of the hour that quality must be improved and not the quantity. So that's why Mudliar Committee focused more on consolidation. Consolidation here means that we need to link the primary health center, secondary health center. So we need to link it. So it actually focused on consolidation more as compared to Bhore Committee. We have the Chadha Committee that was planned in 1963. Its main purpose was evaluation of National Malaria Eradication Program. Why it was very important? Because at that time during independence and post independence, the yeah, was very prevalent. So the main purpose of the Chadda Committee was to evaluate National Malaria Eradication Program. It recommended the introduction of a basic health worker who would perform malaria related duties along with other health activities. However, this model overburdened the health work, which became a major limitation, and so most of the recommendations from Chadda Committee were not taken seriously. Have the Mukherjee Committee that was planned in 1965 to 66. So it was rolled in two phases. The first phase was in 1965 and the second phase was in 1966. So the first phase recommended the separation of family planning staff from general health services. Why was it important to separate the family planning staff from general health services? Because at that time the population was very high and number of jobs were very less, literacy rate was very poor, people were suffering from malnutrition, government was not having enough funds. So it's very important for people to realize that they need to stop or reduce reproduction rate. So in the first phase it was recommended that the family planning staff be separated from general health services. That would actually result in reducing the population. Second, again emphasize on integration and coordination between services. This highlight the importance of balanced planning and teamwork in health services. Now we have the Jungalwalla Committee that was established in 1967. The Jungalwalla Committee strongly supported the integration of health services. What does this mean? That health services, all in all kinds of services, preventive and curative, all the services were actually integrated. Propose a unified health cadre. That means everyone, health professionals are in the unified health cadre. It also focused on common seniority. and equal pay for equal work. That was very you know focused. Why? Because uh, whether somebody whether a man or a woman, despite of the gender or despite of the place where uh, the person is working, the pay should be equal for both, for all types of healthcare workers at the same post. Principles aim to create a strong and ethical public health workforce, and it also focused that the government doctors would not be allowed for private practices. Why? Because if the government doctors would be allowed for private practices, then they would try that more of the people would come to the private clinics rather than availing the services at the government level. So that's actually going to harm the people, the common people. So that is why it also emphasized that no government doctors should be given the permission to do private practice. Then we have Kartal Singh Committee that was formed in 1973. So the Kartal Singh Committee introduced the multi-purpose health workers scheme. Now, what is this multi-purpose health workers scheme? So it states, recommended that one male and one female health worker should be present for every 5,000 population. That means that at each sub-center, we have in the sub-center, we have around one sub-center for 3,000 to 5,000 people. So it said for every 5,000 people, we need to have one multi-purpose health worker. Okay, so this committee played a major role in strengthening rural health services. Now we know that the sub-centers work at the rural level. So, when you strengthen sub-center, when you are incorporating multi-purpose health worker at the sub-center level, that means you are strengthening the rural health services. And is a and this question comes very often, that's how one multi-purpose health worker uh, was recommended for how many people. So it is one multi-purpose health worker for every 5,000 population. And also we need to remember that what were the recommendations of Kartal Singh Committee, like the structure. So it said that there must be one male multi-purpose health worker and one female multi-purpose health worker. And it also emphasized every PHC should have a supervisor. Next, we have Srivastava Committee that was formed in 1975. So this Srivastava Committee focused on health manpower and community participation. Okay, so health manpower, that means the health needs to be the manpower is needed to be focused in healthcare. Focused on manpower and also community participation. That is said that health is not an individual uh, participation thing. The whole community needs to participate, because if the whole community will be participating, then the exchange of ideas, exchange of knowledge, exchange of services would be better. So its main focus was on health manpower and community participation. It recommended creation of village health guides and trained dyes. Now, why are these important? Because these trained dyes were actually trained for pregnancy, for delivery. So at the time, during independence and post-independence, maternal mortality and infant mortality was really high. So the government knew that people actually take help from local dyes, village dyes, for during their delivery. So we thought, why not train these dyes? Because whenever you are trying to build change in the community, becomes because people are very reluctant, and at that time education literacy was not very high, so people were not aware about all the septic practices during pregnancy and delivery. So the government decided we must train these dyes, so that people are already having faith on them. They know that these dyes will be helpful during delivery. had faith in them. So government decided we'll be training these guys so that the maternal mortality and infant mortality reduces. Focused on village health guides and it emphasized community involvement healthcare delivery. So community needs to be educated all in all. It is not an individual thing. Health is not an individual thing. Committee laid the foundation for the ASHA concept, that is uh, ASHAs, accredited social healthcare activists, which we see today under the National Health System or National Health Mission. We have the Bajaj Committee that was formed in 1986, and the Bajaj Committee focused on medical education and human resources for health. It emphasized preventive and promotive healthcare. Okay, so now you see promotive also. Why is it important? Promotive, because when the health is promoted, people are more aware about. So the Bajaj Committee made it sure that healthcare should be emphasized and not just at the preventive level but also at the promotive level. We strongly supported health for all strategy and recommended reorientation of medical education. We actually covered all the uh, post-independence committees that were relevant. Now there are some kinds of health services that have evolved post-independence. So what are these? We just have a look so that it gets framed in our mind. So, India's health system evolved step by step from the Community Development Program and primary health centers in 1952 to Alma Ata Declaration in 1978 to National Health Policy in 1983, then National Rural Health Mission in 2005, then National Health Mission in 2013, and Ayushman Bharat in 2018. So each phase reflects lessons learned from earlier committees. Now we have National Health Policy Comparison. So there are actually three national health policies. The first one was rolled out 1983, the second one in 2002, and then the third one in 2017. See a clear shift. How the focus area actually shifted from the need of the hour to the future. So move from primary health care to decentralization and finally to universal health coverage with strong equity focus. Okay. So you need to remember that what was the focus area in NHP 1983, then 2002, and then 2017. So in 1983, National Health Policy, the focus area was primary health care. In 2002, it was decentralization of health services. In 2017, universal health coverage was the main focus. How equity was National Health Policy 1983, equity was moderate. In 2002, it was increased, and in 2017, 70 and onwards, it is strongly emphasized. Now let's study a bit about National Rural Health Mission. I am covering these topics because these are also very relevant. And whenever you're writing a subjective paper, then if you'll write about those committees and then you'll write about how these committees shaped the healthcare, what we see today, then the examiner gets impressed, and that also makes you feel that you have actually uh, understood the topic very well. So that's why I have covered just National Rural Health Mission, Ayushman Bharat, a little bit. So the National Rural Health Mission, you can see this is the logo, Rashtriya Gramin Swasth Mission, National Rural Health Mission. This logo also comes in examination. That's why I have mentioned it here. What are the objectives of National Rural Health Mission? So National Rural Health Mission aim to reduce maternal and infant mortality, strengthen rural infrastructure and promote community participation. ASHA workers, untied funds, and decentralized planning became key strategies under this mission. Now we have another uh, very important program by Government of India, Ayushman Bharat, that was that was rolled out in 2018. So Ayushman Bharat is built on two pillars. It focuses on basically two things. It has health and wellness centers at specific locations, and it also covers Pradhan Mantri Jan Arogya Yojana, that is insurances. Okay, so basically, Ayushman Bharat provides financial protection of 5 lakh rupees per family per year, moving India closer to universal health coverage. Now, Ayushman Bharat is one of the best government insurances that is rolled out in the world. Okay, so it covers the beneficiaries are the highest in this scheme, in this program. So you need to remember that Ayushman Bharat was rolled out in 2018 when our Prime Minister was obviously Narendra Modi, Sri Narendra Modi, and it works on two pillars. It has health and wellness centers, and also it provides insurance of 5 lakh rupees per family per year. That is also known as Pradhan Mantri Jan Arogya Yojana. Previous year MCQs that were asked in the examination, you can just uh, all these previous year questions have already been covered in the slides that I have just narrated. You can just try, you can just answer. If you want, you can comment in the comment section, and whoever gets all the answers right, I'll just make sure to pin that comment. And so now we conclude this topic. So, to conclude, health committees played a crucial role in shaping India's public health system. Understanding health committees helps us appreciate how health planning evolved and how current programs are rooted in past recommendations. So, if you found this video useful, don't forget to like, share, subscribe to Public Health Insights for more simplified public health content. And also, if you need to give me any kind of recommendation, you can give. You can just comment down, and I'll be very happy to entertain. Thank you for watching.